Good evening, everyone. It's Vrushangi Shah with a fellowship review through the American Journal of Healthcare Strategy. Today, I am thrilled to be joined by Meghan Weihmuller. Meghan, thank you so much for joining me today.
Hi, Vrushangi. I'm very excited to be here.
Yeah, absolutely. And for our listeners that don't know, Megan and I go way back. We actually did undergrad together, but I'm not going to steal her thunder. So, Megan, why don't you go ahead and tell us a little bit about your career journey, your educational background, and what you do now?
Yeah, so I'm Meghan Weihmuller, Director of Primary Care and Population Health Growth at Mercy right now. I started out at SLU, as Vrushangi said, so St. Louis University, obviously in St. Louis. I actually started as a biology major. I thought I wanted to be a doctor because I wanted to be in medicine. Um,
Mm.
and that's all I knew about medicine as being a doctor or a nurse. And throughout high school, I was actually, my last year of high school, I was a certified nursing assistant and thought bedside nursing probably isn't for me. So I'll try to be a doctor instead. Um, and I decided I didn't love chemistry. I could fight through it, but I didn't love it. And I ended up just taking an elective class in health management. And I think I actually had that class with Rashangi. It was a great class, and that's how I found out about the whole side of healthcare administration. After that class, I transitioned my major to health management. And then I ended up joining the 4+1 program at SLU, which is essentially your senior year. You get to start taking grad school classes. So I stayed at SLU to get my master's in health administration, graduated a year after my bachelor's, and then loved St. Louis. So stayed around for, I interned in SSM, and then I went to a fellowship at Mercy and now still work at Mercy and I'm living the St. Louis dream.
I love that. Yeah, and I do remember having that class with you and it's so funny we kind of always stayed connected through those classes, but I'm so glad this is an opportunity for us to reconnect. Looking back at your graduate internship, let's kind of start there. Could you please tell our listeners what made you choose SSM? Kind of what was that internship like for you? Maybe highlight some of the projects that you had the opportunity to partake in.
Yeah. So when I was internship searching, at the time, actually, I started an internship in undergrad at BioSTL, which is a biotech venture capital here in St. Louis. I was really interested in sort of innovation, the startup space, and just really figuring out what healthcare management is and what opportunities I had. So I was loving that, but I wanted to get more opportunity in the actual like healthcare provider health system space. So I was really looking for that summer in between my first and second year of grad school to get into a health system. And I applied to SSM among others. The reason I ended up choosing SSM was honestly because of the preceptor. During the interview process, I just clicked with this person who would be my direct leader. And her name's Heather Rains. She's still my mentor to this day. And I just knew she would be someone who would be an advocate for me and I could learn a lot from her. So I joined SSM and I ended up staying on for the full year. She was at the time the administrator of the cardiovascular service line. So I learned a lot about hearts. She actually gave me the opportunity to stand up our congestive heart failure program, the clinical program at SSM. So through that opportunity, I had a lot of experience with operations, strategy, quality, and fell in love with all three of those things, which is why I ended up doing a fellowship because I couldn't really decide if I wanted to apply for a job in quality, strategy, or operations post post grad. So, yep, that's my SSM experience and how I ended up at Mercy.
Yeah, absolutely. And that's another connection you and I have. So, not during grad school, but in undergrad, I had the opportunity to be an intern at SSM in quality improvement. And you're absolutely right. We'll talk about it a little bit later, but mentorship is so incredibly important, and I'm so glad you had that mentor in Heather. And so now moving right along, tell us a little bit more about why fellowship, what that process was like for you from the application all the way through the interview season, and how you kind of, I know you touched on it a little bit, but how you kind of landed at Mercy of all the choices that you have from fellowships across the country.
Yeah, that's a great question. And it's a question I get asked a lot from our interns pretty much every summer of how did you end up choosing to do a fellowship and this specific fellowship? But I honestly, at the end of my summer internship, I was really thinking before I started my summer internship, I'm definitely going to do a fellowship. Of course,
Mhm.
I'm going to do a fellowship. And then I had my summer internship, and Heather gave me such great exposure to so many different things that were not just her realm, but she let me explore finance and HR and different things that a typical intern wouldn't get to experience so many things within a summer. So she gave me sort of a mini fellowship
Mhm.
experience where I got to experience so many different things. And so at the end of the summer, I was thinking, I kind of got the experience that I think a fellowship would give me. I don't know that I need to do it. But when I started thinking of, okay, if I don't do a fellowship, where will I end up? I wasn't really sure because I fell in love with three different things. So that was the reason I really wanted to do a fellowship, was to have more time and exposure to those different areas I was interested in, to try to nail down what is it that I'm good at and passionate about, and how I can best serve our community and patient population. So that's how I ended up in I'm going to explore fellowship. How I ended up at Mercy specifically was I had a few criteria to nail down where to apply.
Mhm.
So I was loving working in a medical group or clinic space rather than a hospital. Although I thought I would really want to work in an academic medical center and in a hospital, I really liked how specifically in a clinic space you're like the entry door of a health system. And
Mhm.
I mean, of course the ED is also the entry point, but I was thinking of it more of like a whole health, preventative care, primary care clinics, right? So I liked the clinic space. And then I also wanted to stay in St. Louis. So those were two criteria I
Yeah.
needed. The fellowships needed to have one or the other for me to apply to them. And Mercy just happened to have both. I applied to a few that had both. But I think I ended up, I only applied to 5 fellowships. So other people, applied 10 plus. I, because I had those criteria nailed down to only 5. At all 5 of them, I had final rounds, and then 2 of them I was offered. So I had a decision to make, which was very fortunate of a position to be in. Not everyone has a
Yeah.
decision. But I think I made the right decision. The decision ended up just coming down to again the interview process and which people in the organization I met did I feel like they had a lot to teach me, and they would really be advocates for me, not only that year or 2 year long fellowship, but throughout my career. So that's why I ended up with Mercy again, sort of picking a place where I saw a good fit from a people standpoint.
Yeah, absolutely. And you highlighted such important things, but I want to give kudos for not only getting interviews at all the organizations that you applied to, but then also getting multiple offers. I think that is something people don't realize is actually very rare in the fellowship world. So I think it's incredible that you had that opportunity. And so now tell our listeners specifically the Mercy Fellowship. Is it 1 year, 2 year? Project based, rotation based? And then also, did you have a co fellow or was it just you? What are kind of those structural logistics about Mercy's fellowship that you want to highlight?
Yeah, so that's a very interesting question because when I came into Mercy, it looked very different than what it looks like now. So when I came into Mercy, it was a 1 year program, just one fellow, and that was for Mercy Clinic East Communities, is what it was called at the time. And essentially, that was the clinics within greater St. Louis area. So basically, Eastern Missouri, we had several clinics, and they're part of a medical group, and they had one fellow that they would hire every year. So that was when I joined Mercy, see, summer of 2022, so a little over 2 years ago. And at that time, it was structured in three sections. So the first section was shadowing, and it was about 2 months of shadowing experience, 2 to 3 months. And then you would have a chunk of several months of project experience based on the shadowing. So you do the shadowing experience, and then you sort of pick like three places you really liked that you want to do project work. So you do project work with those three areas you're interested in. No brainer. Mine were operations, quality, and strategy. Um, and then the last leg of the fellowship, which ends up, depending on time wise, can be 3 to 6 months, is an interim manager position. So, an area typically where you might be doing a project work or exposed to in some way, you transition into an open leadership role. And historically, that's been a practice manager role, so typically more operations focused. I was probably going to transition into or a practice manager operations role. But I had a situation where I was doing some projects in operations, strategy, and quality. And in December, we had a manager of operations role that opened up. That role opened up, and I was asked to apply to it because I was working with um, one of the hiring leaders for it at the time on a project. She interviewed different people for it, but I ended up getting offered the position. So I moved into that right around the time I would have moved into an interim manager role. So I actually ended my fellowship at about 7 or 8 months. Um, and the role was manager of operations for strategy and quality. And it was a split FTE position. And guess what? It included both strategy, operations, and quality. So, I ended up doing this fellowship to figure out where I wanted to be. And all three of them was an option, didn't even know. Um, yeah, so that's a little tangent, but that was my fellowship experience, which is very much not traditional. And then at the end of that experience, when I was sort of in that transitioned role, we were working on um, bringing in the next year's fellow and sort of revamping and redefining what is this and giving it more structure. And so it had one more year that it was a similar structure fellowship. And then this last year, we actually transitioned, and Mercy is a system that's across 5 different states. And so it's pretty large. It's one of the top five, I think, largest nonprofit health systems in the country. So, very large health system. And we found out that we all had, in our different regions, had different fellowship programs. Everyone had a fellow. Some people had fellows, some people had residents, some people had, they call them slightly different things. Um, and their programs are all slightly different. So, we decided to come together as a system and make a cohesive early careerist program. So we now have the Rotational Leadership Academy, the RLA program, and our first cohort of RLAs started this last summer, so summer of 2024. It's a 2 year program that I worked with our human resources department to help build. Um, Along with some other previous fellows as well. This program is specifically actually catered towards undergrads. So you end your undergraduate, and then we look for highly talented undergrads to go into this program. And the thought is we teach them the MHA program. So they're doing like a Mercy master's program. And then we're also going to start um, it's called ALA program, and it's Administrative Leadership Academy. And then that will be for graduate students. So it will be a 1 year program that is for graduate students. We haven't had our first cohort of that program start yet. I believe they will be starting next summer. Um, right now in our RLA cohort, we have 6 or 7 RLAs with us. So the program is bigger than one. There's a cohort, and I've gotten an opportunity to work with them a few different times and meet with them, and they seem like they're just awesome and living the Mercy dream. They're going to all of our leadership meetings, but also getting involved in really exciting project work. I keep like hopping on a call to talk about a project, and there's an RLA like telling me all about the project. I'm like, I'm so happy you're part of this. It's great. You're getting awesome exposure. So I would say, yeah, my fellowship experience isn't the same as what it is now, but I think it's only gotten better.
Yeah, absolutely. And how incredible that you were a part of building this new cohort, not only for undergrads, but also grad students. One of the things that people kind of pursue a fellowship for is mentorship. So, in your experience during your fellowship, what was mentorship like? Did you have one preceptor that you considered a mentor? Did you have multiple preceptors? What is your takeaway when it comes to mentorship in your fellowship?
Yeah, I think there's so many different types of mentorship, and different seasons of your career, are they important? I think it's
Hmm.
always important to have someone who's a mentor in some way, but you also don't need necessarily 7 mentors at a time. So
Yeah,
it depends for me at least, has depended when I seek out formal mentorship versus informal mentorship. So I had mentioned before Heather, who is my internship preceptor. That was I wouldn't say it was a formal, but it was a easy mentorship where
sure.
he was my boss. So, okay, I look up to you because you're my boss. And then when I moved on in my career, she still was, a authority figure for me. So someone who I could still reach out to. I actually brought her over to Mercy with me, so she's now a leader at Mercy, and I get to see her and talk to her at work still, which is awesome. But I would say she's always been a mentor for me, no matter where I've been. And I think she probably will continue to be throughout my career. However,
Hmm.
I've also had mentors throughout my fellowship um, who were more like peer mentors or
Sure.
alumni mentors, you could say, of someone who just went through the fellowship program the year before.
Hmm.
Um, and that is also helpful because it's someone who is around your age, has
Yep.
had very similar life experience in the sense of they also just finished grad school. They also only worked for a little bit. They know similar people in the organization, so they can help you navigate those types of relationships. That has been very helpful for me to continue. It was kind of natural when I went into my fellowship because I was only a single fellow. There was one fellow my year, me, and then the year before me, there was only one fellow. So I just got mentored by him. And then there was one fellow the year below me. So I mentored her and so on and so forth. Then when I think I've been looking for change in my career or career growth, that's been another time that like seeked out someone, not necessarily in a formal way, but in
Sure.
a sense of, hey, you're in a role that I would like to be in someday. How did you get there?
Sure.
What steps would you recommend I take? So I've done that a few different times in the last 2 years, and not even in a I want your job, but you're doing something that's interesting and seems fulfilling. And how did you get there? And how would you recommend I figure out what it is that I think is interesting and fulfilling and the next step to get to that point for myself? And
Yeah.
that can be internal or external. So I've done that internally, um, but also like ACHE has a formal mentorship program where they pair you with people who are in positions that you think you want to be in the next 5 years or so. So I've done one of those as well. So yeah,
Yeah.
I've probably had 6 or 7 mentors in the last few years.
No, that's absolutely incredible, and I completely agree. I think diversity of thought is so important. You wanna make sure of course, you wanna have internal mentors in your organization, but it's just as important to keep an open mind and learn from people outside so you can kinda get out of your bubble, so I completely understand that. And it's speaking of kind of building a career for yourself and kind of moving forward, you've done incredible, from that ops manager position. I understand, you were a manager of strategic growth, and then now most recently you're a director in primary care and population health. So tell us about, your current role. Tell us kind of the journey from manager to director so early on in your career.
Yeah, 4 roles in 2 years. I didn't see it coming, but it happened. So I sort of talked about the fellowship to the ops manager role, and then I had this role that is kind of unique. I was kind of the catch-all person for Mercy Clinic East communities, where I did strategy, I did quality. I also had our regional float pool reporting to me, which was the operations part of it.
Mm,
So I did a little bit of everything, which I loved because that's what being a fellow is. And I loved that. So it was
yeah,
essentially let me continue doing this in a more like defined way of you actually have a job
sure.
description and you can't just follow anyone around anymore. You actually have responsibilities. So um, I I moved to that role in, I think, around January. We had a very large system restructure in end of March, early April ish timeframe. Maybe, yeah, I think it was April. So about 4 months into my position, we had this restructure. Of course, my position that is not a full time of anything is the one that gets cut because she's not even a full FTE on any of these
Right.
teams. Um, Actually, our quality team in that realm actually fully got removed, and then the strategy team just moved over somewhere else. But they ended up making um, my FTE that was there move to primary care. So we transitioned into
Mm,
performance divisions, which were operations performance division, which is essentially our day-to-day operations for hospital and clinics, and everyone who falls. That's the biggest. Most people are in operations performance
yeah.
division. Then we have primary care and population health, which is primary care operations plus primary care strategy. Um, and we have some care management in that realm, virtual primary care, managed care contracting. So several different things as well, but mostly like things you would consider a primary care bubble. And
Sure.
then we have our service line strategy, um, primary or performance division. And service line strategy is essentially brand standards and strategy across service lines. So we have cardiovascular, GI and surgery,
Hmm.
neuro, ortho, and women's and children's. So across those service lines through the whole system of
Hmm.
Mercy, they're streamlined strategies and brand standards, quality, whatnot. Um, but they work really closely with those operations performance division folks. And then primary care, their strategy is embedded in the performance division instead of it being a separate piece. So I was one of the primary care strategy folks. I ended up in that role of manager of strategic growth, which
Right.
actually ended up working out really well. My fellowship preceptor, he worked in primary care. He's the regional vice president of primary care operations. I ended up sort of leaving his team to go to my next role. And then I just sort of ended up right back at his team. So he was like, yeah, you tried to leave me for 4 months and then you came right back. So it was good. I've already worked with that team really closely. So I knew everyone. And ultimately, I did find out in my fellowship that like I like operations and quality, but I love strategy. So I
Right.
was really excited to spend full time doing strategy. Primary care is also something I'm really passionate about. I really like, the public health and like community wellness and preventative care side of things. And primary care is the closest I can get to that really in a health system.
Right.
Um, so that was really exciting for me. I got to do primary care strategy for a little over a year. I was in that role. Throughout that year, I started sort of mentoring other folks who were on my team in other regions. So, um, different regions had some turnover or they were filling those positions. And as new folks came onto the team, I would mentor and train them, which was great. I really loved working with folks from the different regions and not just
Right.
learning about St. Louis, but understanding, oh, like things are a little different in Fort Smith, Arkansas. You wouldn't believe it, but things are different there.
Yeah.
So I got to meet a lot of cool people through doing that. And then I got exposed to some higher level, like what we call ministry wide, but system wide projects. So a lot of cool reach projects I was given during that year, which I'm really fortunate for. And in doing that, a promotion opportunity came and I got to transition about 2 months ago at this point. It was in July, I transitioned into director of primary care and population health growth. So still working on the same team, but now
Yeah.
is a system wide responsibility. And I get to support the managers of strategic growth, which we call growth managers, throughout the System of Mercy, which has been awesome. I've been doing a lot of travel. I have been going to all different places, Oklahoma. I was in Kansas last week. So I get to go to meet everyone and meet the teams there and see the different initiatives that are happening. So it's been really fun and I'm really looking forward to continuing.
Yeah, thank you so much. And what an incredible journey. So, kind of my next question is, I admire your path so much as a peer. I think you've done incredible things, and I know our listeners will feel the same, especially those early careerists. So, what advice do you want to give people who want to kind of emulate your path or want to do a fellowship? So, essentially, what I'm asking is if you could go back and redo it, or looking back, what are some things you want the new generation of fellows and early careers to know?
Yeah, yeah. Well, thank you first, but I don't think I'm all knowing and I don't know that I have the best like advice because who knows how I got here, right? I sort of just stumbled upon and found my way. I would say the thing for me that I think is like the biggest piece of advice is figure out what you love and what drives you. Um, for example, like right now, what I'm doing, I love it. And, people say that if you don't close your computer at 5 p.m., like that leads to burnout. But I see myself like I'm right now, it's, before this, we started recording this, it was 8 p.m. my time. And I've been like click clacking away on the project. And I was like, oh my gosh, like it's 8 p.m. And
Yeah.
it wasn't because my boss is like going to fire me if I am not working super hard. No, in fact, probably the opposite. She's gonna be like, "Why were you emailing me this late at night?" Um, but I just really love what I'm doing right now, and I think that's something that I would say you need to chase after because I didn't always feel that way. In the last two
Right.
years, I've been in four roles, and there's been times I was like, "This is dreadful." Like, what am I doing with my life? Like, I'm working really
Yeah.
hard, and what what impact am I making? But I feel like I love what I'm doing, and I'm making an impact. Right? Like my job, I just got allocated a lot of capital to build 43 new clinics in the next 3 years.
Wow.
And to open 43 new clinics in the next 3 years, I'm like, this is awesome. We got to get going. Like, we have money,
Yeah.
people trust us, but also we got that money from our system because they know that there's a community need. I was able to
Yeah.
show there's this much deficit of patients who can't be cared for because we're in a healthcare desert in rural Midwest. So we're bringing more primary care to the folks of the Midwest and part of the South and the aging community there. And we're bringing them the primary care services that they need. So that's something that I can spend like days and hours just talking about and working on, and I'm really passionate about. So I'd say try to find something you're passionate about that can drive you. And, if they stop paying you, are you still going to show up for work? Most people are not. Um,
Yeah.
I probably would, at least for a little, you know,
Sure.
maybe not the rest of my life, but at least for a little while, I probably would. So, yeah, that's the goal, I think.
Yeah, no, incredible advice. I think, not everyone is lucky to find a job that they absolutely love, but it seems like you've done it. And so that makes me super happy for you. And usually this is where I end the interview with my guests, but because I know you, I want to highlight the fact that despite being so busy and accomplishing so much, you're also the founder of your own company. So I'm gonna give you a moment. Tell me a little bit more about that. Tell our listeners, where that came about, and what your company, PediaBright, I believe, is all about.
Yeah, yeah. So I founded a company, PediaBright, during my first year of grad school. The company is essentially bridging communication gaps in pediatric healthcare. So we noticed, and not only like my company, but we were told we were actually part of this. It's called MedLaunch, and it's at SLU. They
Hmm.
had a incubator program for students to basically build a startup program specifically in like biomedicine, biotechnology, that realm. So I found that out through the MHA program. Someone came to speak about it, and I was like, that sounds awesome. Like, I'm
Yeah.
interested in strategy, innovation, like healthcare tech. I don't really know what's into founding a company, but this sounds awesome. So I went to like a meeting where we were talking through, and MedLaunch had a problem bank where essentially from community healthcare providers could submit problems of this is currently a problem in healthcare and we don't have a solution for it.
Sure.
And the MedLaunch teams would pick something from the problem bank and pitch a company that solves that problem. So one of the problems in the problem bank was, communication barriers in pediatric healthcare,
Hmm.
because a 5-year-old getting diagnosed with chronic kidney disease and being told they have to go to the doctor every other week and they can't eat or drink certain things and they can't do certain types of exercise and they have to have a certain procedure done, they don't understand what that all means. They just know
Yes.
my life is different than my friends, and I can't play with my friends all the time, and I can't always eat what they can eat, and I feel
Right.
sick a lot. And why? Like, and the doctor might tell them something, but that it doesn't really mean anything to them because they don't have that vocabulary to understand.
Exactly.
So we did a lot of different, let's see, what is it called? Informational interviews where we spoke to not pediatric patients themselves, but parents of pediatric patients or people who are now adults who previously were pediatric patients and
Sure.
what understood what the barriers were and what the true problem is and how we could potentially address it. So that's what we did for the first year or so. It's just let's try and nail down this problem and figure out a potential solution where we came up
Hmm.
with we're going to write children's books that read just like typical children's books like Dr. Seuss, but there's going to be a character in that book that has a chronic healthcare condition. And
Mm.
our first book was about chronic kidney disease. We actually made a trilogy. The first book is just sort of a general about this kid Andrew with chronic kidney disease. Then second book talks more about like the care team, and then you talk more about like actual interventions and whatnot. So
Mm.
goes a little bit deeper in each book, and it allows kids to read the book like it's just any other children's book, but then they
Right.
can relate of, oh, I'm like Andrew, or my sister is like Andrew. So we thought it was a really great, not only for kids who might have a chronic condition, but also kids who might be related or friends with someone with a chronic condition to sort of
Sure.
understand. Yeah, my team is based, it's a 4 people team, so we run pretty lean, but it was at the time 3 other SLU students. And one right now is a journalist, and she's actually a healthcare journalist, which is
Mm,
awesome. She was working for Becker's, and now she's working for Newsweek. And then
nice.
we have 2 med students right now. So they weren't in med school at the time, but they're both in med school now, which is really great because they get introduced to doctors all the time, right? I get to introduce to doctors. Lexi, who didn't have a healthcare major, but now is working in healthcare media, has healthcare connections. So we get to talk to people all the time and just ask them, like, what is your perception of this and
Sure.
how can we make it better? um, yeah, so our first product is out on Amazon. We're working on making some others. It's sort of a passion project for all of us. Obviously it's
Sure.
not our full-time gig, but I'm really proud of us for still sticking with it since 2020 when we first started. So it's been about 4 years, and yeah, we're really excited to see what comes from it.
Yeah, absolutely. And thank you for taking the time to share. I knew that was something I wanted to highlight because I've always seen the updates for it, just being in your network. And I
Yeah.
know our viewers will love to, hear this added piece of like, you can do all things healthcare, you can do a fellowship, and you can still manage to have a side gig and do a passion project.
Yeah, yeah, exactly. And it's all about balance, right? Like, I made the
Yeah,
comment of like, oh, I was click clacking away until 8 p.m. Like, that's not me every night. Like, that can
right.
be sometimes, but then there are all the times that's like, oh, it's 4 o'clock and I got to go because I have a team meeting with my other job at 5.
Yeah.
So, yeah, it's all about balance.
Absolutely. No, it is absolutely about balance. And, kind of with that, Megan, I got all my questions, and I know that the listeners who will listen to this episode will find so much value in it. And so, always good to reconnect with you. But thank you for taking the time. I know it's almost 9 p.m. there. So, I appreciate you taking the time to speak with me and share your journey tonight.
Yeah, thank you so much. I really appreciate it.